It worked. It was a deliberate, careful approach. This is the same approach that we have been and are using on vaccinations. Our priority was and is to save lives. That was our focus. Our moral and ethical duty was to first protect those at greatest risk of dying from the virus and protect those who keep them and the rest of us alive. That group included hospital and healthcare workers, first responders, residents and staff of nursing homes and long-term care facilities, and our seniors aged 65 and up. In the month of February, South Carolina made tremendous progress on expanding access to the vaccinations. As the supply of vaccine increased, new shot locations opened every day. Our hospitals, pharmacies, and healthcare providers became more efficient at getting large numbers of our seniors registered and vaccinated. By staying the course and resisting the loud distractions and potential disruptions, over 1 million South Carolinians have now received the vaccine. Because of these successes, we are now in a position to make the majority of South Carolinians eligible to receive the vaccine. We are ready to enter what is referred to as Phase B, which is the next phase. Starting next Monday, March the 8th, individuals in the following groups will be eligible to make appointments to get vaccinations. And if there's a space available, they can get that vaccination that same day. Individuals age 55 and above. Individuals age 16 to 64 with high-risk medical conditions, including but not limited to the following: cancer, chronic kidney disease, chronic lung disease, diabetes, Down syndrome, heart disease, hypertension, HIV/AIDS, organ transplant, obesity, pregnancy, and sickle cell disease, among others. That's for 16 years old and above. Also included are special needs persons who have developmental, physical, or other severe high-risk disabilities that makes developing severe life-threatening illness or death from COVID infection more likely. Also included will be frontline workers who perform a job in which they are at increased risk of exposure due to their frequent, close, and face-to-face contact with others in their work environment. A few examples of these workers included are these: K-12 and higher education, health care, child care, law enforcement, criminal justice, manufacturing, hospitality, transportation, service, agribusiness, retail, local, state, and federal government employees, and group homes, among others, as will be described by Dr. Summer. Also, I am asking any state resident that has made multiple appointments trying to get vaccinated, if you have already received your vaccination, please go back and cancel out the future unneeded vaccination appointment. So those appointments and that time and that vaccine can be freed up immediately for others who have not yet received their vaccination. Finally, on schools. A few weeks ago, I directed school districts to finalize their vaccination plans with their local health care providers and to submit them to Superintendent Spearman and the Department of Education for review. Superintendent Spearman and a team have worked to verify each school district's vaccination plan so that our teachers can be vaccinated as quickly and efficiently as possible, as mentioned above in 1B. Many local health care providers and school districts have planned to conduct teacher-specific vaccination clinics. Held on school grounds on weekends, afternoons, or at specific times, these coordinated clinics will allow teachers to be vaccinated quicker than if the teachers had to make their own individual appointments. Superintendent Spearman will describe that further in a moment. Finally, we know that students have lost significant learning progress due simply to being out of the classroom. It is clear not only in South Carolina, but all over the country. Parents should not have to choose between their jobs and their children. Parents must have the option of sending their children to school 5 days a week, face-to-face instruction. That is why they pay taxes. Our schools must, I repeat, our schools, all of our schools must open 5 days a week. I've repeatedly asked the General Assembly to send me a bill requiring schools to offer all parents the option of in-person 5-day-a-week instruction for their children. They must have that option. Today I repeat that request to the General Assembly. There are no more excuses or justifications for every one of our schools not to be open 5 days a week for face-to-face instruction. The consequences of not doing that are immeasurable. Our schools must be open. Now I'll ask Dr. Summer of DHEC for his remarks.
Thank you, Governor. I appreciate that. Good morning, everyone. Thank you for being here. It's very happy to be able to start to open our vaccine program up to more and more South Carolinians. As the Governor said, we will now be able to vaccinate more than half of all the people of South Carolina as of Monday. That's a very giant step forward for us. And I want to recognize the fact that we're here today because of the great work of so many people. So let me just briefly thank all of the providers out there, all of the pharmacies, the hospitals, the volunteers. The Governor and I were in Spartanburg yesterday at the College of Osteopathic Medicine there, and a lot of volunteers working in their clinic, helping to make sure every South Carolinian has a chance to get this vaccine as quickly as possible. We've been moving through the folks in 1A, our medical providers, and those who are 65 and over at a good pace. As we've gotten more and more vaccine, we've been able to speed up that process, and as you heard, we've now been able to give more than 1 million doses of vaccine out to the people of South Carolina. As a result of that, it is now time for us to move to 1B. 1B is a large group. We have about 2.7 million South Carolinians in Group 1B. So again, that will really take us forward and get us closer to the herd immunity that we seek, which is 70 to 80% of the population of South Carolina being vaccinated. So this is, again, a big step forward. Thanks again to everyone who's made this possible. A couple things I would note is that, we do ask people to still wait to return in line. If you're not in the 1B group, please don't jump ahead. Please wait, because we are really focusing on the science as we put this plan together. And what we are working on here is identifying those people at the greatest risk and vaccinating them first. If you've seen the chart that shows the people who've died from COVID here, and tragically we've lost already more than 8,000 South Carolinians to this disease, the vast majority of those who've died were over the age of 55. So by adding the age 55 group into 1B, we're going to be able to address that. At the same time, we are still going to continue to focus on vaccinating those who are 65 and over, and making sure every single person in that group has the opportunity to get the vaccine as quickly as possible, with the goal of saving as many lives, avoiding as much serious illness, as many families suffering loss as we possibly can. So with that, we are very much focused again on the science, on identifying those at the greatest risk, and then working our way through those at a little bit lower risk, those with younger folks but who have significant exposure on their job, who live or work in a group setting, so that we can make sure that we do the right thing for every South Carolinian. And our anticipation is that by summer, every South Carolinian will have had access to this vaccine, and hopefully we'll be very close to herd immunity by then. And with that, we can start to return to normalcy, and really focus on not having to wear the mask and do the social distancing. Let me emphasize, though, that for now we do need to still take those safety precautions. Even if we've been vaccinated, still need to wear the masks, still need to social distance, still need to avoid large groups to keep everyone in South Carolina safe. You're not only protecting yourself when you do that, but you're protecting your family, your friends, and all the people of South Carolina. In South Carolina, we have a well-deserved reputation for taking care of each other. I think the past year has certainly shown how well we do that. And if we can just stick with this for a few more months, we're going to get there, and we're going to defeat this. And with that, I'll turn things over to the Superintendent.
Thank you. As most of you are aware, I've been fighting for educators and school staff to have priority access to COVID-19 vaccines since the start of 21. And while today's announcement doesn't exactly prioritize educators and staff, as I'd hoped, I'm very, very grateful that they are now eligible, and that the vaccination plans that every school district has in place with vaccine providers can now be put into place. My message to teachers and school staff: take the vaccine as soon as it is offered to you. Do not wait. It is safe, and our students need you in the classroom delivering high-quality instruction every day as we work to address the academic impact of COVID-19. Vaccinations will eliminate quarantines and ensure that every staff member is protected. My message to the school district administrators and school board members: every family in South Carolina must be given the opportunity to send their children to school 5 days a week face-to-face. This vaccine will help you keep your schools safely opened by eliminating staff quarantines. I'm asking every school district in South Carolina to implement a 5-day-a-week plan immediately. My message to South Carolina's vaccine providers: please put these school district plans into motion quickly, as they are the most efficient way to vaccinate a large group of eligible individuals and will help instill vaccine confidence in the surrounding communities. Everybody loves their principals and their teachers, and they trust them. So when vaccines are given, they can be the great example that we're needed. And the vaccines will stabilize school operations, which impacts the work and life of almost every family in South Carolina. As state superintendent, I want to offer the infrastructure of our public education system to expedite vaccine programs across the state. In the rural area, I talk about my hometown of Saluda a lot. The school is the center of the community. Everybody knows where it is. We've got large parking lots. They know the people there. We can help with massive vaccine sites. Please partner with schools to vaccinate educators, and then partner with them to vaccinate other eligible individuals in the community. Use our communication tools, the reach, the credibility, and the relationships at every school's disposal to get the message out. Let us help ensure equitable access to vaccinations across our state. Let our teachers and staff be the motivators that address vaccine hesitancy in some of our communities. Let's get South Carolina teachers and staff vaccinated, get our students back in school, and allow our families to work and return to a more normal life. Thank you, Governor.
Thank you, ma'am. Are there any questions? Yes, sir. Doctor, one second. Doctor.
Yes, sir. Yes. I think that we've gotten more vaccine. The arrival of the Janssen vaccine, we'll have 41,000 doses of that by the end of the week. That's been a welcome addition. So I think it's been both, as we've been tracking the number of people getting vaccines and seeing the numbers rise a little bit faster than we expected, which is a great thing, and the fact that we're getting more vaccine has allowed us to move forward a little bit quicker than we initially expected. So right now we are filling almost all of our appointments, but we are seeing a decrease in the wait list. We're seeing some evidence that we're starting to work through the group in 1A, and that's why it's time to go to 1B, because we certainly see in the very near future we won't be filling all of our appointments with, especially as we make more appointments because we have more vaccine, we won't be filling all of our appointments with people from the 1A group, and that's why we are ready now to move to 1B on Monday.
One clarification. I heard the number 1 million.
Yes.
That's not what your numbers are showing in terms of first vaccines. Does that combine first and second doses?
It does. So we've given a total of 1 million doses of vaccine, yes, as of this week. Sorry. Yes, sir.
Is there any indication as, what kind of vaccine the teachers would be getting? Would it be the single dose Johnson & Johnson, or would it be the multiple doses?
From our standpoint, they're equivalent. They're all very effective and safe vaccines. There's nothing other than the fact that the Janssen vaccine gives a single dose. They all work equally well, so it's going to be up to the individual provider in that school and school district and those teachers to make that decision. But we are not directing that any particular vaccine be given to any group.
Yes, sir.
Right. Yes, I mean, you stressed that it's important to still, even if you're vaccinated, avoid large crowds. Of course, we just reopened the states and we vaccinate children. Is there anything Is that going to make it more challenging even with the vaccine, or what would you say to people if they're still wanting to go out and bring barbecues or anything this spring? What would be the timeline for actually being able to take life?
Well, I mean, I'm hoping people, even with the mask and that, can enjoy life to some degree. And I think the changes we just made with regards to allowing facilities to stay open after 11 p.m. and limiting the need for permitting for events, our hope is that that will not have a significant impact on the curve that we're seeing. We are seeing a decline in hospitalizations, a decline in deaths, a very welcome decline, of course. Certainly we still need people to act responsibly, as I said. If you're going to be going out, wear the mask, socially distance. You can do those kinds of things and still have fun, still have a good time. And I think the changes we made allow more opportunities to do that while still making good choices and protecting yourself and those around you.
Right there.
Yes, ma'am.
There are 2.7 million people that have funded we want to ensure, particularly with the limited amount of vaccines coming into our state, that folks can get those appointments in a reasonable amount of time.
So I think, as we are adding providers and as we're adding more and more vaccine, there will be folks who won't be able to get in next week. That is certainly true. But we are certainly tracking, and I think if you look at the plan, you'll see that we're hoping to go to 1C around mid-April. We think that we will have enough vaccine, and of course we know not everyone's going to sign up for the vaccine right away. We wish they would, but there are some people who are going to wait and see, and that's okay. So we anticipate, based on what we expect for utilization, that we'll be able to get those folks through, perhaps not in the first week, but certainly in a matter of a few weeks.
Spearman, on vaccinating the teachers. I'm sure there's frustration right now because they're not being prioritized within this. How are you going to guarantee, if at all, that teachers will be some of the first of line in this vaccination process?
I have communicated to district superintendents, and I hope that they're on the phone as we are speaking, calling their providers to get their allotment agreed upon and ready to go. There are going to be a lot of people for sure, but we are prepared, and I think we make a very easy site. So that's why I strongly encourage district folks, call your providers, tell them we're ready to go, and I hope that's happening as we speak.
Because of those relationships that are already established when they
Yes, sir.
made this plan?
Right. I think because we already have our plans in place, it's a very efficient way. Districts already know which teachers plan to take the vaccine, and it would not require them to each person to call individually to get an appointment, but there would be a large group already prepared.
How does that vaccine work? I don't know if like that is there extra guidance on what happens when someone's vaccinated?
Well, I'll just say our message to your question and the previous question is take whichever vaccine is available to you. They're all excellent. And I'm very, very pleased that for us, the important part is once you're vaccinated, you do have some type of immunity and you don't have to go into quarantine. That's what's hurting us right now. We have, schools are back. You can open safely. We've already proved that. But once we're there, there is some transmission. If an adult does not follow the protocol, there can be some transmission. Or at least exposure. So this would help us tremendously in not sending staff home for 10 to 14 days.
And to answer that just a little bit more, the CDC policy, and we certainly agree with this, is that after you've been vaccinated, it takes about 2 weeks after the second vaccine, or for the Janssen vaccine, the single vaccine, about 2 weeks to develop full immunity. At that point, if you are exposed to COVID, you do not have to quarantine for the next 90 days. Now, we're hopeful that as more research is done, we can extend that 90 days, but for now, we know for sure the immunity is strong for 90 days. So for that period of time, then you do not have to quarantine. So between 14 and 90 days after your second dose or first dose of Janssen, you then do not have to quarantine even if you've been exposed.
Is that Cox?
You said that you were asking people still not to jump the line. What is DHEC's guidance to providers on determining who is or isn't a 1B?
So we are basically going to use two things. If you're 55 and over, you can simply show an ID that shows your age. For others, it's going to be self-attestation. We're going to trust South Carolinians to tell the truth and say, yes, I have this medical condition, or yes, I'm in an employment situation that meets the criteria. So we'll trust South Carolinians to do that. I think the vast majority will be honorable and do the right thing. and will, hopefully come and get the vaccine as soon as they're eligible. Yes. So we are looking at that right now. We have just about finished the intent for the long-term care facilities, which are being mostly done through our pharmacy system, is the pharmacies we're going to go in and do 3 passes through each long-term care facility. We've now just about completed the second pass, so we anticipate that the third pass, which is starting now, will largely be second doses. We know how many second doses we need for those folks. Now, there'll be a few first doses in there, too, so we want to leave a little bit of extra space. But we will be in the very near future reallocating some of those extra doses back into the general population so that more people can get the vaccine faster. Now, I can't give you the exact number right now, but we will have that very soon.
Yes, ma'am.
Yes.
A lot of effort toward helping those who are in different minority communities, like Spanish-speaking, or even people who have blindness. But when you add additional folks to the group, it can make it even more difficult for those to get access to the vaccine. Can you talk about how you're going to continue to work to help those in those communities?
Yes, and great question. Thank you. So, first of all, obviously, our informational material, the information that helps people understand the vaccine and that our local partners can distribute. We try to put that in several languages. We are now putting together a video that uses sign language for those who are, unable to hear, so that will be available. But we're also working on getting the vaccine out into every corner of the state. And we do that by adding a number of providers, specifically making sure we have providers in some of our less populated counties. We're also increasing the use of mobile units. The place we were yesterday, VCOM, has a mobile unit, and actually yesterday was going out into the community because our goal is to take the vaccine to people, not make them come to us. And so I think with the combination of working with many local partners who are in the communities and also our mobile units, that's going to help us get to everyone we possibly can. And then again, we're also working on the messaging part to make sure that everyone sees themselves in our messaging at some point.
Superintendent Spearman.
DHEC's guidance to providers has been not to hold match vaccination without appointments. Is that changing as well? Should they offer appointments?
For the time being, we are still recommending appointments, and the reason for that is if you have 10,000 people line up and you've got 2,000 vaccines, one, you've got 8,000 people who just came for no good reason, right? And we don't want to do that to folks. But that's also an opportunity to spread the virus if you have all those people in one place. So for that reason, we are still recommending the use of appointments. Now, many of our facilities do have standbys, which is a great thing because if somebody doesn't come for their appointment, they end up with a few extra doses at the end of the day. The worst thing is a wasted dose. So we want to get every dose into someone's arm, and we've told our providers that. And so if they use waiting lists, if they let people walk up at the end of the day, that's fine. But we mostly want to use appointments to avoid this, having a big crowd of people show up who can't get the vaccine.
Superintendent Spearman, we've heard after the doses, sometimes some people might feel sick the next day. Is there a recommendation at this point to maybe stagger some of those shots for teachers and or kind of maybe do them on a Friday where they wouldn't have school the next day?
Exactly, and that's part of the district's plans that they've worked out. I know of several districts who plan to do at least half of their staff one day and the next, and to do it on Fridays just for the purpose that you said, in case they're not feeling well the next day.
Yes, ma'am.
So they will be spread out through all of our providers. So we're not going to sequester them. Now we will, however, look at sending those to perhaps providers who weren't able to use the Moderna or Pfizer doses because they didn't have the facilities to store them. In many cases, those are going to be smaller providers in areas that are underserved. So we are going to be looking to use some of those doses to expand our provider pool. And we're also considering using some of them at some of our mass vaccination events where it's harder to get folks back for the second dose. But in a general sense, every provider will have access to the Janssen vaccine.
Yes, sir. Like you said, of course, pushing for more people to get vaccinated. Maybe it's to keep testing because, as you see, there's been such a decrease in people wanting to get tested that places are actually stopping the big areas where people do get tested. That's still an important part of the whole process, though, right?
Yes, testing is still very important. We still encourage people to get testing. Testing's still available. If you go to our website, dhec.sc.gov, there's a list there of all the testing sites that are available and what their hours are. And so we very much encourage people to continue to get tested, and to use that as one tool in our toolbox of ways to keep the COVID-19 rates as low as possible and help us overcome this disease.
And Dr. Spearman, vote? And how are we going to make sure that there's equitable access to this vaccine, that people with tighter connections or more power or influence aren't able to, now that they're eligible, just kind of push other people out and make sure that that vaccine is in every community?
So I think we do that in several ways, and that's a very important point to us, is that we wanted this to be available to every South Carolinian equally when they become eligible. That people with connections should not have a higher priority. So for us, we do that, one, by making sure we have providers in every community, and that we are working with various different groups, community groups, faith groups, who represent the people that we serve, and who we can work through those groups to reach the people that we serve. And the third thing is we've certainly communicated very loud and clear to our providers, when you open up those appointments are open to everyone. And, there aren't people who are specialized. Now, we do some groups, like the teachers. We do certainly have our providers working with them. If providers wanted to work with a large manufacturing plant to take care of all their eligible folks, it's easy to get in there and get them all at once. Anything like that increases the number is fine. But very clearly we've said all comers that are eligible are equally able to get the vaccine.
Ms. Adcock?
Do you have an estimation of how many providers we have currently the vaccine and how many have?
So we're not sure how many it'll increase. We have over 500 providers right now. 560, thank you. So we have 560 providers with vaccine right now. We are actively looking. We have several more trained. And as I said, I think the Janssen vaccine is going to let us open up the door to more providers who can manage that vaccine but couldn't manage the other two. I don't know how many yet. We're asking them to come forward. But certainly we think that we'll be able to significantly expand the pool of providers here over the next 1 to 2 weeks. We anticipate that they are continuing to ramp up their production, and we, like every other state, it's given to us per capita, and we fully expect that we will be getting more and more of the Pfizer and Moderna vaccine as they're able to produce more.
Is DHEC allocating the vaccine regionally, like each 37 of 7 that fills out those vaccines can fill out fast enough?
So we are certainly trying to make sure it's equitably distributed across the entire state. We are going to have some advisory panels who can help us identify within an area where we should be focusing our efforts, if there's additional providers we should be adding. So we are going to have some, get some folks to advise us on that to make sure that we're not missing something. But our intent is that our supply is for the entire state, and we want to make sure the entire state gets it equitably.
Yes.
Senator, can you address the Johnson & Johnson vaccine? I think some people think it's not as good as the other vaccines.
Sure.
Can you kind of give your input on that and also make sure that it's equitably distributed across the state too, and not pushed to places where maybe Pfizer can't go, to make sure that it's equitably distributed?
Sure. So let me first say, and just as a point of clarification, some people are calling it the Janssen vaccine, some people are calling it the Johnson & Johnson vaccine. We're going to be calling it the Janssen vaccine. Janssen is actually a part of Johnson & Johnson. So, but if you see those two terms, they're the same vaccine, just for clarification. Now, I think from the standpoint of, where is it going to go, how are we going to use it equitably, is it safe? First of all, the Janssen vaccine is just as good as the Moderna and the Pfizer vaccine. If you're offered the Janssen vaccine, take it. If it was offered to me, I've been vaccinated. If I hadn't been and somebody offered me the Janssen vaccine today, I would take it. And I would advise my family to do the same thing. If you look at the numbers, it's 85% effective at serious illness, and in the study groups, and these are large study groups, tens of thousands of people, no one died who got the Janssen vaccine. That's darn good. So I am quite confident that the Janssen vaccine is equally safe and effective as the other two. So let me say that very clearly. In terms of making sure it's equitably distributed, again, we're going to distribute it across the entire state. If there are some providers who come to us and say, hey, I think I can manage this vaccine better than the other two, then great. We'll do that because we want to have the most number of providers we possibly can. And often those are providers, smaller providers who have less facilities. And that's also a good vaccine that we can go out with mobile units, again, because of the storage requirements. But, we anticipate that all three vaccines should be available across the state. And we're not targeting the Janssen vaccine to one area or one group of people as opposed to the other two.
No questions. Yes.
Superintendent Spearman, yesterday there was some pushback from superintendents who were worried between the call for 5-day face-to-face that you just put out and the possible delays in teacher vaccinations, as it could still take a couple of weeks for all teachers to be fully immunized. What do you say to school districts that are worried that you're putting out a call now for 5-day face-to-face while vaccinations still might take a couple of weeks for teachers?
I'll be very, very clear, and the CDC backs me up on this. The research shows you can open school safely. You do not have to have vaccine in order to open schools safely. We have schools that have been in 5 days a week since August and others that have moved online. It is a safe environment. The vaccination will help us with our quarantines, and that's very important. So I would say to those districts, they need to get back to school. They need to offer an option for the families.
Two more questions in a row. Okay. So, given that you guys already have the district's plans for vaccination, why rely on them to now try to get in touch with the providers? If you've already got the contacts, why not go ahead and try to help them coordinate?
Well, that's the intention, for them to go ahead and get started. They're ready to go, but you know, it takes that final, it's time. So it's time now to put your plan into action. So that's what I'm saying to our superintendents and to the providers.
Yes, ma'am. What I was more asking was, why not have the government, the state government, help them to help them to get them vaccinated, to schedule these events instead of saying the local governments?
Well, there are 1,267 schools in the state, 79 school districts, and they're all in very different circumstances, and they need to work with those local providers. So that's why it's better done on an individual basis, and many providers are working with multiple districts in their region. And I would say this is being done more on a regional basis than it is just district by district.
Dr. Zimmer, actually, since obviously so many more people are added, can you update us on the status of VAMS and what's been improved to make this sign up easier and involved?
Sure. No, great question. And let me just start out first by saying that Superintendent Spearman and we are in complete lockstep. It is safe to open schools. We need to do that, vaccine or not. But to answer your question, VAMS is still a little bit of a challenging program for some folks. One, you have to have internet access to use it. Now, there have been several improvements. You no longer have to have, in the past, every person had to have their own email address to use VAMS. So if a husband and wife used the same email address, they had to create a separate one because each person had to have their own. That's now been changed. So VAMS no longer requires separate email addresses for each person. It's easier now to set up appointments in VAMS, and especially it's easier to set up a second appointment. So you can make your, if you're getting Pfizer or Moderna, you can make your appointment for that second vaccine now the same time you make your appointment for the first vaccine, which is, I think, a big plus. The third thing is that with the call center, the call center is available to folks 7 to 7, 7 days a week, 7 a.m. to 7 p.m., 7 days a week. They will help you make an appointment. So if you don't have internet access, you're having struggles using the appointing system online, call them and they will help you make an appointment. So, you never have to log on to the internet. They will make that appointment for you and work with you on that. Because we want every person to get the vaccine and we don't want anything to stand in the way.
Bill, thank you very much.